The idea that papaya and passion fruit could hold cancer-fighting properties may sound like an exciting breakthrough, but experts urge caution. While preliminary research suggests that certain fruit compounds might have biological effects, the reality is far more complicated. The study presented at FAPES Week in Germany hints at potential therapeutic applications, but there is no solid evidence yet to support their effectiveness in cancer treatment. Worse, hyping up these findings could lead to false hope, misinformation, and even risky medical decisions for patients seeking real solutions. One of the biggest concerns with studies like these is how early-stage findings are interpreted. Just because a fruit extract shows promise in a lab setting doesn't mean it will work in real-world medical applications. The process of turning a natural compound into a viable treatment takes years, sometimes decades, of rigorous testing, clinical trials, and regulatory approval. Even then, most experimental therapies fail to make it to market because they do not perform as expected when tested on actual patients. The research highlighted in this study focuses largely on modified pectins, fiber compounds found in papaya, passion fruit, and citrus fruits. While these pectins have been linked to gut health and chronic disease reduction, their ability to combat cancer is far from proven. The scientists behind this research have developed extraction techniques to isolate and modify these pectins, but the actual medical impact remains speculative. The fact that these compounds are being tested in animal models rather than human trials underscores just how far this research still has to go. Another major red flag is the risk of overselling the potential of fruit-based compounds while ignoring the broader challenges of cancer treatment. Cancer is a highly complex disease with many variations, each requiring specific treatments. Immunotherapy, targeted drugs, and chemotherapy have taken years of research to develop, and even they do not work for every patient. The idea that simply consuming fruit-derived compounds, or even taking them in supplement form, could replace or significantly enhance existing treatments is misleading. Furthermore, the patenting of these modified pectins raises questions about commercialization. When research is tied to potential financial gain, there is always a risk that results will be exaggerated to attract investment or consumer interest. If this leads to premature claims about the effectiveness of these compounds, patients could end up wasting time and money on unproven treatments instead of pursuing scientifically validated options. The dangers of promoting unproven cancer treatments are real. Misinformation spreads quickly, and desperate patients may turn to experimental or alternative therapies that lack proper clinical backing. This is not just a hypothetical concern. History has shown that false medical claims can lead to harmful decisions. From the unregulated supplement industry to misleading natural cure movements, many people have suffered by placing their trust in treatments that ultimately failed them. While further research into plant-based compounds is valuable, it is critical to separate scientific curiosity from real medical breakthroughs. Until these fruit-derived compounds undergo thorough clinical testing and regulatory approval, they should not be seen as anything more than an interesting area of study. Patients should be cautious of exaggerated claims, and the medical community must be vigilant in preventing the spread of misinformation. The road from laboratory discovery to effective cancer treatment is long, and many promising compounds never make it past the research phase. Until definitive evidence emerges, papaya and passion fruit remain just that, fruits, not cures.